who are going to be dealing with the various issues that we have packaged for today's media briefing. So we have amongst our panelists, we have the CSIR Head of Information and Cybersecurity, and who's also the technical leader of the National Policy Data Observatory under the Department of Science and Technology, Science and Innovation. So that is Dr. Jabu Mtsweni. We have also in the panel, Deputy Director General in the Department of Health, Dr. Nicholas Crisp, who is going to be taking stock basically on vaccine supply and distribution. As you all know that we have set some timelines and targets. So he'll be giving us more on that. And we also going to be joined this morning by the health head of department in the province of KwaZulu-Natal, who is Dr. Sandile Chabalala. He will be now he's going to give us a breakdown of some of the responses that the province has been pushing to deal with the surge of COVID-19 cases. And we're just going to get a brief overview of what they are actually doing in the province. As we know that we've also had some of the unrest and some of the health systems were affected. So that presentation is going to come through from Dr. Shabalala. And we also have the Deputy Director General of Health, Dr. Anban Pillay. He is going to give us a presentation on epidemiological trends, and he's going to be responding to some of the public concerns that have been raised on why we basically not testing before vaccination and some of those issues that are going to come through in that presentation. And as part of our program as well for this public webinar, we also have a Q&A session, questions and answers, so that our media colleagues are able to ask some of the pertinent questions that they have based on today's presentations. We will then open up a session for those questions about 15 minutes or so, also dependent on the time that we'll have today. And we also encourage all our panelists that are here today to please just respond to some of those questions on chat so that we also save a bit of time and we cover most questions. The Director General of Health, Dr. Sandile Buthelezi, is also here with us. He is going to be assisting with some of those, to field some of those questions that we'll be getting from our media colleagues. And as previously indicated, the Deputy Minister, Dr. Pahla, is going to be doing closing remarks. And before closing, obviously, we'll do those questions. So, but what's important is that we cover everything before 9 a.m. And without wasting any more time, finally, I'm going to welcome the Minister, the Acting Minister of Health, Minister Kubai, for her opening remarks. Thank you.
Thank you very much. Thank you. Good morning, everyone, and welcome to our weekly media briefing. For joining us, I know some of the people have been saying it's a bit early. We must try and see if we can find a better slot. I think the team will work with the broadcasters to see if we would be able to, but we do find that this is one of the best slots that we're able to get with the media colleagues. Just to start by indicating that on Monday, the COVID-19 death toll reached 70,000 mark. And for as long as the number of infections continue to rise, the death toll will continue to increase. This is sad news for us to continue to see many lives being lost. And we continue to urge South Africans to be cautious because this requires all of us to do everything we can to ensure that we both bring the number of infections and the number of deaths down. We send our condolences to the families that they have lost their loved ones due to the pandemic. For us to achieve this required interventions, we need to continue to practice the non-pharmaceutical interventions and vaccinate, and the two interventions are not mutually exclusive. Getting vaccinated does not mean you cannot get infected. It lowers the risk of severe symptoms as we've had over time and death. Non-pharmaceutical interventions remain critical for bringing down the number of infections. In the last 24 hours, there were 13,751 new cases, which is a significant decrease from that of the day before, which we had 17,351 new cases, and we had to check what was the cause of this. And I think Dr. Anpan will try and explain some of this so that all of us are on the same page. I think our colleagues in the media thought that we had actually opened up earlier, and this were the discussion and some of the questions that were asked to President yesterday as we visited the vaccination sites. Despite the spike that we saw on Wednesday, the number of new cases have been on a downward trend. We are, however, concerned about the rise of numbers in the Western Cape, which have now surpassed Gauteng in the number of new cases in the last 24 hours. If you can recall, Gauteng has been the epicenter of the third wave, and now the majority of new cases in the last 24 hours are from Western Cape, with 29% of new cases, followed by Gauteng, which is still a bit higher, with 27 new cases. We'll be keenly watching the situation so that if the numbers continue to rise, we can introduce the necessary, we can ask NCCC and Cabinet to introduce the necessary interventions. It is important to remember that in anticipation of this, we had Dr. Claude from Western Cape Province with us in one of the sessions that we had here in the media briefing, who shared the state of readiness in the Western Cape, and we continue to monitor that, and we'll continue to provide support from National in dealing with the pandemic in the province. Dr. Pillay has joined us, as Klingwe said, to unpack the epidemiological trends based on what we observed thus far, and also how we are dealing with the surge management and issues that we are picking up around COVID-19 management that needs to be responded to. Although as a country we have reached and passed the peak of the third wave, there are provinces that are still on the upward trajectory, and especially Western Cape, as I said, and KwaZulu-Natal. In other provinces, such as Northwest, Free State, and Northern Cape, the number of cases have been relatively low, but containment measures in these provinces are still critical in managing the pandemic. This week, we have invited Dr. Sandile Shabalala from KwaZulu-Natal province to present the surge response and interventions by the KwaZulu-Natal province in managing the pandemic. On vaccine supply, as the president mentioned in his address on Sunday, our country and our continent has been able to secure vaccines and will in the future be able to manufacture vaccines on our continent. This means that the uncertainty around vaccine supply is a thing that we're going to see of the past, and our vaccination program will be significantly fast-tracked. This as well we emphasize, especially as we engage with our manufacturers, to keep to the timeframes and deadline dates that they've given us in delivering the vaccine, because if they miss a date or delay with a day or two, it impacts negatively on our vaccine program. This week, our vaccine supply was constrained, which negatively affected the rate of vaccination as some of the sites ran out of vaccine and people had to be turned away. The good news is that we have received more vaccine from J&J and more Pfizer vaccines expected in the coming days. Dr. Crisp will provide details on the number of vaccines we already have and what we are expecting in the coming days, including the donation that we have received from the USA. The certainty of vaccine supply means that we will have sufficient supply to meet our immediate needs. Last night, I received a MAC on vaccine advisory, which I will present, advisory, which will present the advice and our recommendation to NCCC and IMC on vaccine. This is in relation to questions being asked about opening up for more vaccines to meet our demand. The advisory specifically focus on two vaccines, which is Sinovac and AstraZeneca. We'll communicate government's decision in a coming week once we have engaged with NCCC and IMC on the matter following the advisory that we received last night. In this week, we were expecting that the number of vaccination in terms of our vaccine rollout, in this week, we expected that the number of vaccinated people per day to reach the president's target of 300,000. As I said earlier, we had the constraint in terms of supply, And therefore, our vaccination in terms of vaccinated people per day was around 220,000, which is likely to be the average for this week. At the present rate of vaccination, we are currently vaccinating 1 million people in 4 days. The number of vaccinated people has just surpassed another milestone of 7 million. And we had hoped as well that with the 300,000 per day would have been far ahead of this number. So this is a week that we can term from our side, not a good week in terms of vaccine, but we are looking forward to the coming week because it will be much better. With expected vaccines batches from J&J and Pfizer in the coming days, we are expecting that the vaccination program will pick up the momentum such that we will be able to reach at least our 300,000. And some of the colleagues, including in the private sector, are saying we should be able to reach at least around 400,000 per vaccination per day. This will observe between the 300 and 400 and see which one and how do we ensure that where there is capacity and where there is a need to intervene and respond to certain mechanisms to enable the fast tracking of the vaccine and ensuring that vaccine reaches as many people as possible, we are able to intervene. By reaching this target, we'll be able to vaccinate 1 million in 3 days, if this is what we are able to do. As I said, in terms of the targets, and we're working on this, and members of the media and ladies and gentlemen, know that at each week we are doing a review. So we look at our vaccine program, we look at where the feedback is coming from, what are the issues that we need to address, we intervene and also check in terms of the capacity, check in terms of whether this response means that we're getting more numbers, meaning more vaccine on the hands actually. So that's what we are looking at, and we continue to look at the numbers. So I'm making this reference so that when you see the changes in numbers and targets, you would understand that this is a continuous evaluation, continuous improvement of the program itself. By the time we open for the people between the ages of 18 and 34 to be vaccinated from the 1st of September 2021, we'll be able to respond to the demand that this cohort will generate. This, they call themselves the owners of the country. I'm not so sure where that comes from, but each generation as we move, they have tend to create a vibe around them. And also what becomes what we are seeing is a word of mouth in terms of marketing for us, but also not only in terms of talking to people, but convincing and able to respond to even those who have vaccine hesitancy. We're joined today by Dr. Jabu Mtsweni from the CSIR, who will present vaccine projection based on trend analysis so that we can better understand how quickly we will be able to vaccinate the majority of our people. This presentation was presented to us in IMC, and I must indicate that this is one of the areas where it's independent by CSIR, monitoring, checking what we are doing in terms of the vaccine, and able to actually say whether we'll be able to meet the deadlines and the targets that we've set ourselves. Yesterday, following the visit by the president to Tembisa and to Kanaka, which was fantastic, seeing vaccination program going and the sites being able to keep to the demands, I also visited 2 workplace vaccination sites in the Northwest. The first visit in Northwest was to the Sibanye Stillwater Mine Vaccination Initiative for mining employees, and the second one was at the Sun City Vaccination Site, in which I took my first shot jab in terms of Pfizer vaccine. And you can see I'm still up and running, doing very well, no side effects, and able to function effectively. The Sun City site is currently vaccinating workers in the hospitality sector as well, not only Sun City workers, but workers in all the surrounding hospitality businesses. Soon, both of the sites in terms of the Sibanye Stillwater Mine vaccination and also the Sun City worker vaccination site, they will be opened up for vaccination of the surrounding communities, becoming the mass vaccination sites for us. These are examples of how private sector is collaborating with government to bring vaccine to the people. I must reiterate that we all have freedom of choice, and not one can force you to take the vaccine, not even your employer. So those who have raised concerns about potentially employers forcing employees to take vaccine, the position and the policy from government is that vaccine is voluntary, So you make a choice based on the information we provide you to be able to say, this is my right to take the vaccine, this is my choice to take the vaccine. And as you do that, whether you take the vaccine or you do not take the vaccine, please, we urge you not to infringe on the rights of others. Throughout this period, I must indicate, ladies and gentlemen, in terms of management of the pandemic, in terms of also dealing with and rolling out our vaccine program, our healthcare workers are our heroes and our heroines. And we thank them for the great work they continue to do, the people they have cared for and the lives that they have saved. One of the things that we are seeing as we do the visits in the vaccination sites is the energy levels, the commitment of the workers, the feedback that they give us to say, please improve this, please do this so that we can be able to save more lives. But each and every day, they've been able to stand and hold and give hope to many of us who have found ourselves a bit hopeless. Many people find themselves in distress, many reporting of mental health issues, challenges because of fatigue in terms of the pandemic, but just the issue of having lost a lot of people. There are weeks or days where one would receive messages of many people who have passed away. Those who actively participate in social media, timelines will be flooded with messages of condolences. And this puts a strain in a nation. And that's why our healthcare workers, our social workers, our frontline troopers, who have been at the forefront of giving us hope, caring for us, counseling us, giving advice, and just being there for us as a nation. And that's why we continue to say to them, we salute them, we appreciate them, because they've carried us so far. They've been the pillar for many of us in our communities. Together as well, we want to appreciate the religious leaders who in the communities have been able to provide support to the families who've lost their loved ones, in noting that because of the pandemic, you find difficulty with people not coming like previously. You'd have a lot of people coming into your home, providing comfort, providing care. But right now, the most needed people or the most available people to us as families, as communities, are the religious sector, who are able to come, faith-based communities, who are able to provide support, who are able to provide counseling in the most difficult time of our families, of when we have lost loved ones. It is this because, I say this because as South Africans, we have to continue to remember our strength is when we stand together. Our strength is when we hold hands and guide each other, provide support for each other. And just a call to somebody just to check. You don't know what they are going through. They might be needing that message on that day, just to get them through for that particular day. For those who are infected, most of the time they find themselves in isolation, they find themselves in quarantine, where it could be a lonely place. A message to give them hope and comfort, to say it will be, tomorrow will be better than today, is important. This we have to do, South Africans, all of us holding hands, because to beat this pandemic, it's not only government that has to do the work. It's not only the healthcare workers that have to do the work. All of us have to do the work, and we can be able to beat this pandemic. Thank you very much.
Thank you, Minister. Very important point there about having to stand together and work as a collective in this fight against COVID. And so thanks, Minister. That was very insightful. And I am going now to request Dr. Nicholas Chris to come through and take us through as we take stock of our vaccines. Thank you.
Morning, thank you very much. Morning, Minister. Morning, Deputy Minister, ladies and gentlemen, colleagues. I'm going to keep this quite short because I'm sure there's lots to get through today, but everybody is wondering what's happening with vaccines. So as the Honourable Minister said, it's good that we are able to share this information. Perhaps just to take stock of what we are trying to achieve and where the vaccines are going. This was what was mentioned a moment ago. We crossed the 7 million mark this week. with 7,297,912 recorded vaccinations on the electronic vaccine data system. And this is a very busy slide, so it's just for studying afterwards. But what I wanted to highlight is that we have been reaching our vaccination target as we've been building up the capacity on the ground and the vaccinations, but we are not reaching the most vulnerable sufficiently. And that is something that we will be focusing on the weeks ahead, and would like to ask the media to assist us with, is that we cannot forget the older population, specifically those over 60 and those over 50 as we move forward. We are also managing to get to our throughput targets on average, but as the Honourable Minister said, this week was a difficult week with little vaccine in our pipeline, but nonetheless on the build-up we have on average met our throughput targets for this week, but we have not met the public-private mix. And we are focusing on that because we know there's significantly more capacity in the private sector than is currently being utilized. Just in terms of when I talk in a moment about what vaccines we have, our target for August is to reach 7 million people over the age of 35, but we must ensure that at least 1 million of those people are people over the age of 60. We cannot leave that population behind. Otherwise, we are not going to be able to keep the very ill people out of hospital. So at least 1 out of 7 vaccinations during the month of August needs to be of people over the age of 60. We have also noticed, as you'll see on the right-hand side, that the uninsured population are dragging behind in terms of the proportion of them that we are managing to reach, notwithstanding the increases in the total vaccinations that have been possible. This population, particularly in urban areas, is not coming forward as readily as, or not being vaccinated as readily as we would have liked. And specifically a message to the men out there, we are not managing to reach that many men, specifically in the older age groups above 50, the men are not turning out in their numbers for vaccination. And we would really like to encourage men to come forward for vaccination. We have 10 districts that are also lagging behind the rest of the country. And since our motto is leave nobody behind, we are going to focus very heavily on trying to get additional resources going in both the public and the private sector in those 10 districts. So we are moving into week 12. And so the target for this week is a minimum average of 290,000 per vaccination day. And each province, that is the total vaccination shown in this table, that we would like to reach in the whole province. So that's between the public and the private sector, minimum of 290,000 per day, now that we are going to have vaccines. And you'll see in a moment. That is a 61% increase from week 8, when we started measuring our massive ramp up and vaccines started to become available. So onto vaccines, we have 2 vaccines, as everybody knows, that we are presently using. The mainstay up till now has been the Pfizer vaccine, the 2-dose Pfizer vaccine. We procure from 3 different sources, and I'll show you numbers in a moment. First one is a direct procurement from Pfizer, it's in the United States. And this vaccine is the main vaccine source that we have had up till now. We have had a COVAX procurement. That's where we buy from the COVAX facility. It has been a once-off so far, but we are able to buy from time to time as Pfizer vaccine becomes available on the COVAX facility. We are able to buy more if we wish. Our minister referred to the COVAX donation from the United States. I'll talk a bit more about that in the next slide. Johnson & Johnson has been our second vaccine in our fight against COVID. But we all know that there's been a global challenge with Johnson & Johnson's supply, and it's only just being restored now through our company here in South Africa. And the provinces have been using the short expiry date Johnson & Johnson that we got as a stopgap and it was originally targeting only the public sector essential worker programs. But from Monday the 26th, we have now started putting it into the population program because we now have a continuous supply of Johnson & Johnson coming. Part of that focus will be to make sure that we get people in the pension pay queues vaccinated. A large number of those people are obviously over the age of 60. There are people under 60 with other grants that are being paid, but it's really nice if we can get to this population with a single dose vaccine. So to look at some numbers, and I'm almost done. What you see in the tables is the top table is the quarterly commitments for delivery of vaccine. And you can see in Johnson & Johnson, the quarterly commitment for Q2, which is done, and Q3 is shown, and those are the vaccines, that's where we are at the moment. Where Johnson & Johnson, we expect to get 10 million doses. Pfizer, our procurement, we should get 16 million doses. We have bought Pfizer COVAX, and we're hoping we're going to be able to get another Pfizer COVAX. And then in red below that, the Pfizer COVAX donation, which is due in the next day or two, which is a very, very substantial donation arriving from the United States during the course of the weekend and into the early part of next week. It's so large, it's not coming in one consignment, and it should be into the pipeline during the course of next week. Q4, we still have a lot of vaccine in our procurement, both 19 million doses of Johnson & Johnson and close to 9 million of Pfizer. So people should feel comfortable that we are now back on track for our full procurement. The weekly deliveries, our immediate horizon is shown in the table below. The vaccines that are shown under the 26th of July 2021, the 1.4 million Johnson & Johnson vaccine has now arrived, and during the course of the weekend will be finalized to go into the pipeline for delivery in the early part of next week. The Pfizer vaccine that comes on a weekly basis has arrived. It arrived on Sunday this past week, and the next vaccine expected from Pfizer of 1.5 million doses is also due, and we understand that there's no delay or commitment on either the 2nd of August week delivery nor the 9th of August. So those vaccines are now flowing into the system according to the time schedule that we expect. The big step up we got is the figure shown in red under the Pfizer COVAX donation. As I've mentioned, it's this weekend and into the early part of next week. That vaccine will make a massive difference. If we are able to now step up our capacity, as we believe we are, to 1 million doses every 3 days, then close to 6 million doses on donation is going to make a massive, massive difference to our capability. But as the Honourable Minister said, we've had a challenge in this past week that we've run down on our stock. Our total stock on hand as of yesterday morning was only 7 days, which means 6 days now. And fortunately, now with the Pfizer doses arriving and the donation doses arriving and Johnson & Johnson arriving all within a space of 5 or 6 days, we are finally out of this vaccine dearth. And from the latter half of next week and into the week after, we expect to see massive increases in our capabilities in the field. So the conclusion is that provided the vaccines are delivered on schedule, there's no vaccine constraint going forward, and the anticipated rate of vaccinations, there are enough doses for us to complete the year, and we don't need any further procurement based on the rates and our expectations for the remainder of this year. Thank you very much.
Thank you, Dr. Crisp, for that great news indeed about our capabilities and the fact that we do have adequate stock available so that we can be able to ramp up. And now I am going to request Dr. Jabu Mthweni to take the platform for a presentation just around CSR projections on vaccines. Thank you.
Thank you, Program Director. I hope you can hear me and you can also see my slides.
Yes, we can hear and can see this. You can see you, not the slides. They're coming through now.
Oh, okay.
Yes, you can see.
Thank you, and good morning to the Minister, the Deputy Minister, the DG and the DDGs and the colleagues. Thank you for the invitation. And my presentation is just going to focus more on the performance of our vaccination program, including sharing some what-if scenarios in terms of where we would want to go probably by the end of the year or the end of the financial year in March. So looking at just the presentation outline, you would notice that very short, but we'd look at the trends, and the minister, I think, has spoken a lot about some of them, and then we'll just focus on the what-if analysis, and then share with you some phased performance, including just giving some global perspective in terms of measuring ourselves as well. And I think some of the context that is very important in order to understand some of the work that we'll be presenting is that the vaccination program, obviously you have two sides of it. You have the trial or the Sonke, which started in February. But what we are looking at now is the national program, which started in May. And currently the assumed target date or the end date where at least we would have vaccinated the adult population is the 31st of March. So based on the global trends, there's quite a number of things we need to look at over and above just maybe the vaccines or the numbers. And we need to look at issues such as, are we following a 5-day strategy or a 7-day strategy? Are we doing a 2-dose strategy or a 1-dose strategy? Because all of these factors, they have an influence in how we do, in terms of our performance. But at the same time, there are other external factors that one needs to look at, which we see that are impacting some of these programs, for example, in the US and the UK, such as the hesitancy rates, stock availability, the different vaccination policies, and so on and so forth. So at this stage where we are today, there's no country that has reached the sort of purported herd immunity of 67%, but we have Israel, which is pretty much a small country, about 6 or 9 million people, sitting at 62. Hence, our view when we look at the data and the numbers, we see that a collaborative and a coordinated effort is required in terms of ensuring that we accelerate our vaccination program. And I think currently where we are now at the national level, we see that we have reached our 7 million mark, which is very good. But there are other indicators that we look at. For example, I spoke about the 7-day and the 5-day average of doses administered. So when we look from the 17th of March, the 17th of May, we are currently sitting at an average of about 173,000 doses per day, which in essence is if you were looking at the 1-dose strategy, is not far off. But the other important thing that we need to look at as well is the issue of our vaccination strategy in terms of the vaccines themselves. Currently, where we stand, we are sort of 80-20, meaning that there are more Pfizer doses that are being administered compared to J&J. Why is this important? J&J only requires 1 dose, meaning you just vaccinate a person once and they're fine. But Pfizer requires 2, which means a person needs to return twice, and that affects us in terms of the targets. So when you look at this specific slide, we are just showing the trends in terms of the averages from when the vaccination program started, although this one just shows a snapshot. And we are choosing the 2 days because we generally know that the program tends to accelerate during the weekday, and then on weekends it tends to dip, as I will show in the following slide. And that obviously has an impact on how we reach our target. So when you look at this specific slide, you see that in terms of the weekends, we have big dips, with our national vaccination program. But generally then what we are seeing as a positive sign is that on weekday, we are almost reaching about over 200,000 doses, on average. On weekends, on average, we are doing about 26K. So you can see the differences there. Gauteng is leading in terms of administering the highest numbers, whilst other provinces, such as the large ones in particular, they are not so consistent. As we indicated, other factors such as the social unrest and stuff like that, they do negatively impact our vaccination program. The minister, I think, did speak about how many days it takes us to administer 1 million doses, which is pretty a good indicator as well. What we are seeing, for example, now, on average, it takes us about 9 days, at least since July, it takes us about 9 days to administer 1 million doses, which is not so bad, but we need to do something like 2.2 in order to reach the herd immunity if we are on a 2-dose strategy. And then, so in terms of these slides, we are focusing basically looking at various scenarios, the what if analysis, and saying, where should we be depending on where we are now? So if you look at our vaccination strategies, I indicated earlier, is a 80-20, but we also focus on what we have already done. So currently, if we look at the 7 million, we generally, if we are using a 2-dose strategy, we are looking at about 64 million additional doses that needs to be administered. But this assumes that everyone will get the vaccine, which generally maybe it's not a true reality. But what the projections are saying is that if we are going to be from, let's say, the 29 till the end of March, we want to reach our target, we need to be doing something like 264 doses per day. And as we have heard from the minister, the president has already spoken about 300K. So we are not so far off in terms of reaching that specific target. Now, there's other things we've factored in. For example, let's look at a situation whereby we consider a 15% hesitancy rate. In other words, 15% of the adult population say they don't want the vaccine because it's optional. So you will generally then be looking at about 54 million people if we are using a 2-dose strategy. Generally, that means that from today till the end of July, we would need to do about 223K per day, in order to reach that target. If we are only vaccinating for 5 days, we would then look at 313. And then the other thing we looked at as well, because the supply and demand may always change, we looked at to say, if we are choosing, let's say our scales tipped, and then we are now on a J&J dominant strategy, our requirements per day will also drop, because as we indicated, the J&J requires one jab compared to the other one. So as you would see, if we are on a 5-day, then we will be required to do about 230,000 per day. And then we also compare ourselves against others to see whether our expectations are realistic or not. And you would notice from this specific slide that countries such as France, and what we have selected here is countries that are almost more similar to us in terms of population. So if you look at France, which is about 60 plus or 68,000 population, you would see that they are doing something on average about 500,000 per day. And South Korea, which is almost the same as us, they are doing just above 200,000. And South Africa is right up there in terms of the doses that are administered per day. So we are in Africa actually doing quite well. So our targets are not far off, and I think they are possible for us to meet. Obviously, the other thing we look at is to look at our phased targets to say, of course, we see that we need to reach a specific big number, but it does not help to judge ourselves against this big number. So we need to look at the phased target. Where are we? Where should we be? And what is the shortfall or the surplus? So currently we are at 7 million. If everything was equal from the 17th of May to date, we should have at least done about 16 million if the supply and the program was universal. So far we are seeing, based on our data, that we are about 9 million sort of back. However, this needs to be taken into context that our program is not open to all. We are doing it in phases. So some of these shortfalls could easily be recovered, for example, when the 35s plus are getting vaccinated, or the others who are below, maybe the 18 plus. And then the other stuff we look at as well is looking at the provinces, because the vaccination program is also very dynamic according to the different provinces. So we also look at their performance versus the phase targets over a period of time. Here, looking obviously, looking at the start date of the 17th of May. So what this slide generally tells you is that take a big province like Gauteng. Currently, they are at about 1.8 million. If everything was equal and the vaccination program started at the same pace, they should be at about 4.2 million. They are behind by 2.5 million. So you would see, for example, a province like Gauteng, because they have big numbers, they are required to do more But if you look at other provinces such as the Northern Cape and Mpumalanga, their numbers are a little bit small. Hence, you see that in terms of their targets, they seem to be a little bit lower. However, a lot of effort required in these provinces because they don't have as many vaccination sites compared to, for example, Gauteng, KwaZulu-Natal, and the Western Cape. And then as the last one, we tend to also look at our performance in context with other African countries. So if you see in the African continent, South Africa is administering the most number of doses compared to the rest. And of course, we know that Africa is, in terms of supply and the vaccination, they are behind, but there are positive signs that at least the jabs are getting into the arms of the people, but there's still a long way to go in order to reach herd immunity. And then as I close, obviously, I want to emphasize as well that the vaccination program is influenced by a number of factors, not just the supply. And these factors, as I've indicated, whether it's the policies, the hesitation, they play a very big role. Hence, the number of doses per day are just a basic indicator. They are not a silver bullet. We require consistent performance over the entire period, which obviously will be impacted by various other things, such as your weekends, special holidays, like your festive season, national events such as elections, and so on and so forth. However, as it stands now, we see that the program is picking up, of course, in order to catch up as people are registering. I thank you, and the Minister.
Singiwe on mute.
Apologies about that. Thank you so much, Dr. Msweni, for that presentation. I'm now going to request Dr. Anban Pillay to come through and make a presentation on the epidemiological trends. Pardon, thank you.
Good morning, Minister, Deputy Minister, DG, and colleagues. This morning, I'm going to take you through the epidemiological trends in the COVID response thus far. If I can just put this on slideshow, 1 second. Hope you can see that, Shlingiwe.
Yes, we can see it.
Thank you. So if we look at the epidemiological trends for this week and the past weeks, you'll note from the graph below, if we look at the number of new daily tests, there's been a decline as fewer people are reporting coming through with symptoms. And if you look at the proportion that's positive as well from all tests, you can see there is a decline relative to what it had been. On the right-hand side is the table with the percentage testing positive of the population, and you can see that at one stage we were close to 1 in 3 people that are testing positive nationally from the tests that were done. In the past week, we have had about 1 in 4, so about 25% of people that are testing positive for the virus when they come through for PCR tests or antigen tests. This decline in the number of cases is seen quite markedly in Gauteng. As you can see, the red line, a significant drop in the cases. And on the other side, we have concerns relating particularly to the Western Cape, and then the little green line here at the bottom that's showing a tendency to increase is KwaZulu-Natal, and I'm sure Dr. Shabalala will talk more about their plans in preparation for potentially any increases in cases there. So at this stage, we're watching very closely what's happening in the Western Cape, and I think they've had a number of measures put in place to anticipate an increase, and KZN today will also share with you their plans. Looking at the weekly percentage testing positive, comparing the past 3 weeks data, You can see that in the case of Limpopo, although the numbers were really high in terms of the percentage testing positive, we're seeing a decline. In the case of Mpumalanga, it's looking fairly flat. Gauteng, the decline that we saw in the other graph coming through here as well, and the Northwest also showing a decline. In the case of KZN, as you can see, there's this slight increase in cases. And the Western Cape as well, a similar trend. The Eastern Cape has also got a similar trend to KZN. So it's the three coastal provinces that were behind the curve in terms of the infections that happened in Gauteng that appear now to have increases in cases. The Northern Cape had a decline in cases, and in the past 3 weeks we're seeing an increase, and we've been engaging with the province to try and see how we can halt the spread of the infection there. When we look at the hospital admissions, both in terms of the admissions as well as the deaths, comparing the number of average admissions in the previous 14 days to the current 14 days, we can see in general across all of the provinces, except the Eastern Cape and the Western Cape, that there have been declines, and some good declines in the case of Gauteng. So far fewer people coming into hospital with moderate to severe disease. But in the case of the Eastern Cape, and more so in the case of the Western Cape, there are increases, and that's largely correlating with the number of cases that are increasing in the Western Cape. The hospital mortality obviously is a lag, because this happens over a much longer period. So even though you have declines in the hospital admissions and cases, you will see for a while that the mortality within the provinces will continue to occur for a long period after the actual decline in cases. The only province that's showing a decrease in mortality is Gauteng, given the significant decrease in numbers there as well. But you can see quite big increases in mortality in the Western Cape, given the increase in cases, as well as in KZN and the Eastern Cape as well. So we're anticipating that the coastal provinces will have these increases. Moving then to the sequencing, this is a work that is being done by the Network for the Genomic Surveillance for South Africa, the NGSSA, which is a team of scientists across the country, which require fairly specialized equipment in order to understand which variant is prevalent where. And you see all of the various laboratories and teams that are working across the various provinces to try and get a sense about what are the variants and that are dominant currently. And so from the information that we have to date, we can see that historically we were dominated by the beta variant, and this is in the purple line, purple shading. On the left, on the top part of the graph, we're talking about the percentage, and at the bottom is a number. And you can see that the beta variant was dominant for a long period, and then Delta came along and has effectively displaced beta as the dominant variant across the country. So if we look at prevalence of the variants as of July 2021, we can say that of the sequences done, Delta makes up about 85% of the variants, and beta makes up only about 4% now, and alpha a small proportion in many of the other variants that are not of concern at this stage, make up a very small proportion. So at this stage, we are dominated still by the Delta variant, and the good news is that the two vaccines that we are using against the Delta variant, which is the Pfizer vaccine and Johnson & Johnson, remain effective against this variant, and so we can be confident that there's protection. Coming then to the forecast for the weeks going forward in terms of new cases, we can see that Gauteng will continue to decline. In the case of Free State, it's going to be fairly flat, and the Eastern Cape slight decline as well in the number of cases. KZN is going to have a slight increase in cases, but Limpopo is showing significant declines. In Mpumalanga as well, we will have those declines as well. Western Cape is going to show increases, which are predicted from the other graphs as well, and will probably peak at some point. in the next couple of weeks. And then the Northern Cape is also showing an increase. We're concerned about this, and we really need the Northern Cape colleagues to get a handle on what's happening there. The Northwest is showing a nice decline as well, which is great. Looking at weekly hospital admission forecasts, this predicts whether our hospital beds are going to come under pressure with the number of cases that we have. The yellow refers to a median level of occupancy. The orange refers to a high admission load, and the red is a very high admission load. And you can see that the Eastern Cape at this stage is in a fairly good state. The Free State was in the red zone, and it's come down, but it needs to reduce quite significantly more. Gauteng as well has shown that good decline. KZN is increasing, and we need to try and keep that within the orange zone at least, so that we don't get into the red zone. Limpopo has come down. Together with the numbers, we can see the decline in the hospital admissions, and this is predicted to continue. Mpumalanga as well is going to continue to have those declines. Unfortunately, the Western Cape is still in the high admission load of the orange zone, and we're hoping we can keep it in that area, and the predictions are that it will remain there and not get into the red zone, is where the pressure on beds start becoming quite significant. Northern Cape has a lot of pressure on beds at this stage, and it seems to be remaining at that level if the number of cases don't decline. And then the Northwest is showing some declines in the number of beds and the prediction of a decline there. So in summary, nationally, we can say we continue to see decreases in case numbers and the number of tests over the past week. The percentage testing positive is decreasing nationally. Gauteng, Limpopo, and Mpumalanga showing decreases. But there are increases in the Eastern Cape, Western Cape, KZN, as well as the Northern Cape. The Gauteng decreases in incidence, as well as percentage positive, as well as hospitalization. We're closely monitoring Western Cape as well as KZN, because we anticipate that there will be increases in those two provinces from the predictions that we've seen thus far. And the Delta variant still remains the dominant variant across the country. Thank you very much, Lingwe. I'll stop there. Sorry, you muted, Lingwe.
Thank you so much, Dr. Pillay, for that. We are now going to request Dr. Shabalala, who is the head of department in the Department of Health in KZN. He is going to give us a sense of some of the, the things they've been doing following the unrest, because we know that some of the health systems that side were disrupted. But he's going to give us a sense of how they are managing that situation, including just the COVID surge response. Thank you. Dr. Shabalala, you can take the question.
Good morning to the Minister. Good morning to the Deputy Minister, the DG and the colleagues. I think I'll start by agreeing with Anban that we are seeing increasing numbers of new cases and active cases in the province. And as such, we have already prepared our beds to admit more if a need arises. Currently, we are having, of the active cases, of the total cases, 4% are still active, but we are worried that only 12% of those are currently admitted, whether in the private sector or in the public sector. It's worrying in the sense that as we had Anban, we are seeing a mortality also increasing, and we find that some of the people that die are people who would have been in self-isolation. What we are doing with those people is to increase how we try to monitor them while they are at home, because they are at home out of choice more than anything. I'll speak a little bit to our bed status currently. And we therefore are using our nurses and our CCGs to try and follow up on some of those that are on self-isolation, the 88% that are on self-isolation. In terms of the bed numbers, we have more than 4,900 beds that are available for COVID-19, whether isolation, PUIs, and ICU beds, on top of which we have 834 field hospital beds. That said, we are seeing that our occupation of these beds is currently very, very low, with the private sector admitting most of the patients compared to the public sector. In terms of isolation, only 24% of our isolation beds are occupied now, and only 38% of our ICU beds are occupied. What we have then tended to do is to encourage people to, through the different mediums. We had the minister coming to our province last week, and among the advices she gave was that we have to look at a surge plan, which we already have started. I'll speak to that a little bit. And with that, the messages we send through the media is to encourage people that when they get sick or when they get to be positive and the relatives are unable to take care of them, and they should then be admitted. But I think we are not seeing those admissions going up as we had expected, and also as we are seeing in other provinces. We have also intensified our contact tracing. We're trying to go back to where we were tracing and finding people within 24 to 48 hours. In some instances, we find that difficult due to the fact that some of the addresses are not really easy to find given the rarity, but also some people would have given us wrong addresses, which we are trying to work on as well. So we are ready, we are doing everything to admit as much as we can. The unrest that did take place in the province have not shown us a different picture. We have been getting fluctuating figures. Yes, our numbers are increasing slowly. We had expected that after all the unrest, our numbers will increase very much. We have passed a 7-day period, but we still have not seen a very big increase, which we were preparing ourselves for. We still are monitoring that, and we are hoping that it's not going to be. However, we are preparing in case the increase happens, we are fine. I think I will not go very deep into the vaccinations that have been mentioned, but since the minister left, we started a program which we've called Siagoma Waya, and we go to the different media houses. We encourage the very media persons to vaccinate, and we use them as influencers to also encourage other people to vaccinate. They easily have access to the community compared to us as officials in particular. The program is led by our MEC. When Minister was here, we were having 190 sites that were functional, and at that time we had vaccinated 1,135,285 people. But as of yesterday, we are having 205 sites that are active. We have vaccinated 1,282,417 people. We also have increased our partnership with the private sector. Just last night, we were finalizing our partnership with SPA, and the SPA group is having a footprint in all the towns in the province, and we're going to be using them to vaccinate their staff and the relatives of that staff. It's we're following on something that we started with Toyota, where Toyota opened up their warehouses for us to be able to open those as vaccination sites, and again them vaccinate their staff, their relatives, but also we have agitated for the vaccination of the communities around that, and we have agreed that we're going to do that. From that private partnerships that we're seeing, we've been able to vaccinate 83,612 people with the first dose of Pfizer, and we have vaccinated 36,605 on both doses of Pfizer. So we are making progress. We think it's going to be even quicker. What we are trying to do is to see ourselves doing more than 50,000 vaccinations on a daily basis. So at the moment, that's where we are as a province. I think I will not go into a lot. Our recoveries are fine in that we are sitting above 90, but we think we can do better if we were to monitor the people who are sitting at home or isolating at home even much more. So that is the situation in the province. I think more importantly, we still are monitoring whether the situation of the unrest, whether the days after the arrest, whether the days after what happened in Swaziland are going to impact us very much. We also are seeing our incidence risk going up, but we are speaking with also the provinces around us to ensure that they also participate, because the mobility of the people does contribute to the whole factor. So that is how far one can go with the province. Thank you. You are muted, ma'am.
Pardon me for that. I keep muting myself today. Apologies for that. Thank you, Dr. Shabalala, for that. Those details around what the kind of work that the province is doing. We are now going to move and give the media, our media colleagues, an opportunity to pose questions. And it's about 15 minutes. We'll just give it a go and see how far we can go, because we will need to hand over to the Deputy Minister, Dr. Joe Patla, so that he can close. So I will then start with going through some of the questions that have been put through chat by some of the colleagues. I have one question from Sibongiseni from Radio Kwezi, who is basically asking about the issue of the concerns that have been raised by some members of the public around the vaccine itself and the safety, the claims that have been put up front about people being sick, people possibly dying. So the question is around that, what is being done, and whether or not it is indeed correct to force people to take the vaccine. Minister has responded to that, but I'll also just give it to the panelists. And we also have another question from Malian Guardian Shama Duplessis. Shama is asking a question basically about, I'm just trying to get to it and scroll. Okay, I'm not getting to that question. I think my screen has frozen here. So I'll move on to the next question. I'll come back to Shama's question. The other question we have received is from Jonisai Maromo, who is asking a question to the minister, in fact. With the high figures of new infections, particularly in the Western Cape and KZN, is the Department of Health not observing laxity in respect of COVID protocols? What are you doing to ensure communities stick to the COVID regulations? The other question we have also received is from Siphelele Dludla from Business Report. Now that question is directed to the minister. Can Minister please unpack the details of the department's strategy in terms of procuring the Sinovac Coronavac vaccine after it was approved with conditions for emergency use by SAPRA on July 3rd? Is the government not going to buy this vaccine at all? And will the rollout strategy continue to be anchored by Pfizer and J&J doses? Siphelele is also referring to a doctor saying that one of the doctors had said that there would be no need for further vaccine procurement this year, but that the department is taking in a new cohort of 18 to 34-year-olds, from September, and he's saying that we basically have seen vaccine uptake ticking up to 34. So I think that question, Minister did in fact speak to it, but I will allow her to also just deal with it again. The next question to our panelists, it's relating to the Sinovac issue. Actually, the DG has responded to that question. So I will take that for now, Minister, as I try and get Minister and panelists, as I try and get to the other questions on the other chat that seems to have frozen on my screen. But let me leave it to the panelists to tackle some of those questions. Thank you. Maybe we can start with Dr. Chris.
Thank you, Tlingiwe. So I've also been trying to answer some of the questions in the Q&A. So sorry, I was a bit distracted typing there. But what I was saying about the vaccine is not that we don't need potentially to have another vaccine, any other third vaccine. That is a consideration. But the Honourable Minister, Acting Minister, already said in her opening statements that she had received an advisory and that that now needs to be considered, the contents, because it only came last night. So all these questions are very valid, and we do need to take that into consideration. But for now, we certainly have a lot of vaccine. We have over 10 million doses will be in the country, physically in the country by the end of next week. And that's the best position we've ever been in. It's really good news. And then, of course, there are more deliveries coming during the course of the month of August. So by the time we open for the the 18 to 34-year-olds, there will be a lot of vaccine in the country, unlike we have found ourselves in the past week where we were a bit depleted. So I think that's the point I was trying to make, is we're in a very strong position at the moment with confidence, and the public should not panic that we are going to run out of vaccine because we're opening other cohorts. Thank you.
Thank you, Dr. Crisp. I will hand over to the Director General now to respond to some of them.
Thank you very much, Tlingiwe. For me, I think I want to respond to the issue of the increasing number of cases. I think Dr. Crisp has covered the issue of the vaccines and the procurement of Sinovac. I think what we want to say about there's quite a number of factors that we are actually looking at in terms of the increased number of infections. I think the person who asked the question is right on the point. The issue of the non-adherence to non-pharmaceutical interventions is one of the most important issues that is driving new infections. So we are actually depending on one of the whole of government approach in terms of dealing with that. One, communication. Two, actually enforcing the compliance to the regulations. But also we're depending on the people themselves. I think the communities must take it upon themselves to ensure that they actually, they themselves, they take responsibility for their lives. You can't really enforce something all the time. People must know that, I mean, if you don't really stick to what you're supposed to stick to, you're always going to have a problem in terms of infections. So that's what we are trying to do. And of course, the third one, the most important is what is the vaccination. So our rapid rollout of the vaccination program is one of the things that will take us out of this situation, not taking away the responsibility from the citizens to ensure that they stick to the pharmaceutical interventions in terms of social distancing, washing of hands, wearing of masks, and all those issues. So for me, those are the issues that I think they are very important. Thank you very much, Lenio.
Thanks, DG. Minister, would you like to come in?
Yeah, just to re-emphasize, I think the major issue here about the number, there's a question around issues of people who are dying, side effects. When you go and take a vaccine, I've done that yesterday, you do receive an SMS that talks about the side effects you will have, and that talks about should you have concerns or anything, you can register. If you have severe side effects, where to contact, the number to contact, and all those. And I think let's urge South Africans, in those that are saying, in our families, I've had somebody who has died after taking a vaccine, to register those. I've had a couple of those this week where I received calls, SMSs. We've referred them to the relevant officials. They've done the work, they've started to do the work, because there's a need for investigation to check whether there is a link between the vaccination and the death of the person. But again, more important for us, and I'm urging South Africans to ensure that as we interact, we take the vaccine, please, as you go to your health practitioners, in the vaccinators, in the sites where you're vaccinating, please ensure that you disclose. Be honest in what you have as comorbidities so that you can be able to take. But when you are given advice to say, for example, when you come back, don't take anything else but take paracetamol, do that. Because in that way, we are also contributing to helping each other in managing the pandemic. But again, more and more, I'm getting people not knowing. Yesterday and even this morning on TV, you'd have seen that some of the doctors are saying people actually present themselves to facilities to say, I'm sick, I've got COVID-19, please vaccinate me. And the issue is, you can't take the vaccine, you can't take the jab when you're already COVID-19 positive. You need to be able to wait until the pandemic is, or you've passed the stage, you no longer have it. But also in terms of you afterwards, there's waiting period between after you've tested positive and having symptoms, which is, I understand it's between 30 to 35 days that we need to be able to observe. That's very important, because that's what we need to be able to communicate. People do sit at home, not take the vaccine when they are supposed to. And then later, when they find out that they are positive, they think then the vaccine will assist in terms of preventing severe illness or even potential death. So that's why we always advise people to say, actually, make sure that you are clear. Even when you arrive, if you've got flu, you've got that, be open to the nurses so that they can be able to advise to say, you can't take the vaccine. That's why there's screening on site. And I thought Dr. Pile will touch on the issues around, because there's been quite a growing call to say to us, please make sure that can we not test people as they go to take the vaccines, because they are picking up some of the people who have passed away. I've got few people who came back to say, actually, they took the vaccine only to find that they didn't know that they were positive. And I thought Dr. Pile will come into this, because there's been studies and research work that has been done. I had asked him to follow up on this for us to deal with it. So there is quite a lot of information that needs to go out, and that's why we've been urging public representatives to help us in carrying the message. But we are also saying, as South Africans, let's help each other and make sure that we pass the information. But as we go to the sites, ask questions that we would want to ask, be clear on issues, and then you'll receive advice as part of the work. We continue to urge South Africans, as we say, we are not yet out of COVID-19. We still have to manage the pandemic. So continuously, it's important for us to remember that when we open up, because sometimes the mistake, people think that when restrictions are lessened, therefore it means the pandemic is gone. It's not gone. That's why sometimes we find upward movement and then downward movement. So fluctuation of the numbers is because sometimes people tend to want to think that the pandemic is gone and therefore you can do as you please. It's not. We must continue to observe the non-pharmaceutical interventions. But similarly as well, please let's avoid gatherings. Large gatherings are a problem. Funerals are a problem in terms of gatherings. That's why the regulations prohibits night vigils. So it's not about the president being able to monitor you. It's not about the police being able to see that you are having a night vigil. It's about you taking responsibility as a citizen to say we are not going to be the super spreaders of this pandemic. So having a night vigil, knowing that maybe police might not arrive, it's detriment to your own family, it's detriment to your own loved ones. So we should try by all means as South Africans to be responsible. We need to work together. That's why we are calling for working together so that we can manage the pandemic. Thank you very much, Cindy.
Thank you, Minister. You know, I just have two more questions. I think it's the issue of media. There's a question from Linda Mnisi. around the inoculation of media aged 35 and above. They're just wanting clarity on that, Minister, to say that they understand that there has been that the process has been officially opened. And the other question that we have from Marvin is just clarity around citizens who are not documented or citizens who are not declared South Africans who in terms of vaccination. So those are the two questions. The rest of the questions have been responded to on the chat, and thank you for that to all our panelists. Thank you, Minister.
Yeah, I think Dr. Crisp must come in. Thank you.
Yeah, Minister, thank you very much. Thank you, Thengiwe. So the media vaccination, there are 1,800 and a few journalists and cameramen and so on that have been uploaded onto the system, and that vaccination has started. If it didn't start yesterday, it's definitely starting today. And that is the last of the priority groups that we have been preparing for and administering over the last couple of months. Sorry, the other question was, sorry, Thengiwe?
The other question was around undocumented.
Yes, sure. So we've been working on a project for a while now to provide, so that the challenge of vaccinating somebody who's undocumented is to be able to track the record of the individual back to that individual in case something should go wrong, or if you need a record of the vaccination, and to account for the vaccines. And without some form of identity, that's obviously a challenge. So we know that this is going to be with us forever. And so we have been working on a process for allocating to those people a health specific number that we can use for recording health records. And that is underway at the moment. It is more complicated than meets the eye, but it is a project that has been ongoing, and we're certainly hoping to have it done in time that we can begin to vaccinate undocumented people in due course. Thank you.
Slingiwe, can I respond to the question?
Yes, you can go ahead, Dr. Pillay.
Thanks. I think on the matter about testing before vaccination, I think it's important first to say that the WHO and other global bodies have recommended that even if you have been infected with COVID, you should be vaccinated. Now, on the matter of testing itself, the evidence suggests that certainly after you've had a COVID infection, you will continue to present as a PCR positive simply because of viral particles that may be shed as a result of infection. So the value of testing is very limited in that context. That's why we say that after you've had your active infection, thereafter you can be vaccinated, not while you're having active disease. That means you're having severe symptoms, and therefore the disease is still fairly active in your context, and then you shouldn't be vaccinated in that situation. But once the infection has subsided and you don't have symptoms anymore, then certainly vaccination is recommended. Thank you. Thanks, Slingiwe.
Thanks for that, Dr. Pillay, for that clarification. And I'm now going to wrap up our session because we are definitely running out of time. Minister, I don't know if I should now hand over, if you are okay, I will hand over to the Deputy Minister, Dr. Phahla, to give us his remarks, his closing remarks, in fact, before we wrap up the session.
That's correct, Slingiwe.
Thank you, ma'am.
Thank you very much. Thanks, thank you, and good morning to Minister and the team and the colleagues. Maybe just to add on the last point from Dr. Anban Pillay, just to add to say that, in fact, the recommended period after active infection, just to make sure that there is a bit of certainty, we recommend 30 days after when the symptoms have subsided, that people can go for vaccination, just so that we add certainty. Good morning to all South Africans, and thank you very much for and the media for participating in this media briefing again. We are encouraged indeed by the continuing steady decline of new COVID-19 infections, as indicated in the presentation by Dr. Pillay. as we get the figures on the daily and weekly reports from the National Institute of Communicable Diseases. The behavior of this third wave is indeed taking a similar pattern to the first and second waves. As we see new cases reducing, as indicated in the graphs, from Gauteng province, which has been our epicenter, we see that the cases are rising in other provinces, as indicated in the Western Cape, a major one, but also in KZN, but other provinces are also showing a decline where they had already reached the peak of the third wave. But regrettably, as shown in the graphs, the deaths from COVID-19 continue to rise. And we have seen that over the last few days, I think over the last 2 days, on average, between 400 and 500 deaths reported. And as explained in the presentation, that's because as new infections rise, the complications, the admission to hospital, into ICUs, like that, they come behind the actual infections. And therefore, regrettably, we are still in the midst of this, the grip of this third wave. So the pressure on our hospitals still remain quite high. Now, I'm raising these points as just to also buttress the point which was made by a minister not long ago, and also raised by the president as he was speaking to us on Sunday, to say that as restrictions are being adjusted from adjusted level 4 to adjusted level 3, it's in no way an indication that it's time to lower our guards and relax our personal and community protection. This is a continuous process through which government has the responsibility to balance the saving of lives, but while at the same time saving livelihoods. So the need from time to time to relax the restrictions, it's guided by the fact that while we need to assist our society in terms of saving lives by reducing movement, but at the same time, we need to balance that with the livelihoods so that people can be able to be economically active. So one would say that this fight against COVID-19 should not be equated to a sprint, as we are now in the Olympic period. We should be familiar with those terms, but it's more like a marathon. And we have to use multiple tools to reduce the infections, limit the disease and admission to hospital, and also limit the fatalities. So in this regard, we again take our heads off in appreciating our health workers, the sterling work which they continue to do in the front line in saving the lives of South Africans on a daily basis, while acknowledging that in the process, they are risking their own lives. So we urge all South Africans who qualify to take advantage of the opportunity for vaccination to come forward and be registered and be vaccinated. There is now ample evidence about the safety of the vaccines, and also the fact that the vaccines indeed do save lives, not only in South Africa, but also all over the world. The evidence, there's now ample evidence that those who are vaccinated have a better chance of not getting infected. If they do get infected, of not getting sick enough to seek admission to hospital, and even a lesser chance, a lesser risk of ending up in the ICU, and even a lesser risk of dying from the COVID. Now, in our own country, as much as we are still early in our vaccination coverage, but because we started with various groups, and first of which, as we know, with the Sisonke project of J&J with healthcare workers, there is already evidence from our healthcare facilities that in this third wave, there has been less and less infection of our frontline health workers, less and less admission, and fortunately also less and less fatalities amongst our health workers. So if anybody had still had any doubts that the vaccines do work. We don't have to look only from to, other countries, Europe, the US, and other countries, but we can look here at home. Our own healthcare workers, many of them have been protected by the vaccination which they've gone through, and I'm quite confident that the teachers, as well as being the next cohort, in a few months' time, they will see the benefits of the vaccination, and so will be our police force and military. Now, as more of the 35 plus come forward, we urge them to register first so that they can facilitate smooth service at vaccination sites. We want to emphasize that while in making things easy, our president also said that those who come forward at vaccination sites should not be turned away, but it will make life much easier for the recipients of the vaccine, for the health workers who are administering the vaccine, if we register first, so that when we go to the site, then it's going to be much smoother. And when the time comes for the 18 years plus, we also call on them from the 1st of September to please register first. That will make your life much easier. Many of you have smartphones, so it shouldn't be a difficulty for you to register first. But we also urge you again to help your older parents and grandparents who have still not been vaccinated. As already reported earlier on, that I think it was Dr. Crisp who made the point that in terms of the vaccination of the 50 plus and the 60 plus, men especially, I'm calling on my fellow men to come forward, especially those of us over 50 and over 60, and we call on the younger people, please bring your parents and your grandparents, your uncles and aunts to come forward and register on using your smartphones and bring them to the vaccination points. It's going to be very important that we use all the weapons at our disposal so that we can be able to manage to live safely side by side with the virus, because as I've indicated that this is going to be a marathon. So before we can reach a stage where we can say COVID-19 is defeated, we're going to have to live with it, and we must use all the non-pharmaceutical interventions, but also make sure that we come forward to be vaccinated. I want to end by saying that vaccinate to save your own life, but also vaccinate to save the lives of your family, but also vaccinate to save the life of the community and also of South Africans overall. Thank you very much.
Thank you, DM. I think that now brings us to a close of the session. Thank you to South Africans who've joined us since early this morning, and to our panelists who are always willing to come through and join us as we impart this important information. But importantly, colleagues, we will be seeing you again next week around the same time. We will communicate this, and then we will then bring this session to a close for now. Thank you to everyone.
Thank you. Bye, everyone.
Thank you very much.